Privatization is such a broad term that it's basically useless.
Technically, every doctor is a private contractor. The difference is who's providing the care and who's paying for it. In public hospitals, a knee replacement surgery costs the province around $10,000. In a private for-profit clinic, patients pay up to $28,000. But when a province pays for a surgery in a for-profit clinic, the amount is kept secret.
That's one of the challenges with understanding the relative costs in the for-profit sector is provincial governments routinely deny access to those contracts.
Ontario plans to pay for certain services in for-profit clinics, a model BC has used for years and has made changes to.
Cataract surgeries, they repatriated those services into the public sector because they were more expensive in the private for-profit sector.
The latest wait time data reveals 68% of patients in BC had their knee replacement surgery within 6 months. Ontario did better. Same goes for hip replacements.
There's a purpose for
doctors insist Ontario doesn't need more clinics.
You could do operations in this operating room. You don't need to open up new facilities.
And he says hospitals are only funded to do a specific number of surgeries per year. Governments could pay to schedule more on evenings or weekends, but the real issue is staffing.
We need people. The bottleneck right now is particularly nursing care.
But for-profit clinics recruit nurses from the same pool of workers. A nurse or doctor leaving for more money leads to longer wait times in hospitals.
I really worry that people don't completely understand the long-term impacts of some of these changes.
Studies of the UK and US have also shown private for-profit care can lead to slightly higher death rates.
So when we're looking at private financing in our system, in multiple examples, it tends to have worse patient outcomes and tends to have more financial inefficiencies. So why would we be looking to expand that aspect of our existing health system?
The Angus Reid Institute survey shows political leanings tend to drive people's views on privatization, but most doctors insist there are cheaper, safer, faster ways of getting more Canadians the surgeries they need, including centralized wait lists that connect patients with the next available surgeon instead of sitting on one surgeon's waiting list. Christine Birak, CBC News, Toronto.